So we will be re-recording it. We were just recording the bit that's the discussion, that Lorna and Kate and Emily will be talking. If you have any discussion afterwards, we'll be stopping the recording for that, so that won't be going out, because I think this will be useful for other people. I'm not going to talk anymore because I'm very keen that we let those who are delivering this work actually speak. So we've got Lorna, Kate and Emily. We're going to be, do you want to introduce yourselves? I'll let you go first, Lorna.
Hi, my name's Lorna Longworth. I'm a GP at West Road Medical Centre in Fenham, and I'm a clinical director for one of the networks in Newcastle. And the primary care networks are groups of GP practices working together into their communities. There's 7 networks that cover the whole of Newcastle, and I'm here representing all of those networks.
Thanks. And then Kate.
Hi, my name's Kate Vogelsang. I work for an organisation called Newcastle GP Services, and we are the GP Federation. So we work with and look after the practices across the city. And I'm here to talk about our role in how we are delivering vaccinations, which are led by the GP teams across the city. So that's my primary role. At the moment, it's all encompassing.
Thank you, Kate. And then Emily, do you want to introduce yourself?
Hello, I'm Emily Fisher. I also work for Newcastle GP Services as operations support. I've been working at the COVID vaccine sites recently, working with the marshals and supporting Kate and Lorna with community engagement work.
Excellent. Thanks ever so much. Right, I'm going to go on mute and I'm going to then let the PowerPoint go on and let you take over.
Great. So Carrie, if you're able to screen share for me, everyone, I've done a very, very brief PowerPoint presentation that just covers a little bit about what's going on in Newcastle around the vaccinations. And as I say, it is really brief, so it's hopefully just a base for us then to go on to have a conversation. Okay, so if we could just go on to the next slide, please. We've done our introductions already. So in Newcastle, we have 2 sites. They're called local vaccination sites, and these are the ones that Kate mentioned that are run by the local GPs in combination with Newcastle GP Services, and we're getting lots of support from other services within the city, such as the fire service and the local authority. They're running out of 2 sites at the minute, and that's the Eagles Basketball Community Arena, which is in Scotswood, and the other one is at Newcastle Racecourse up in Gosforth. And we've also done a fair amount of outreach for those people who can't physically get to those sites, particularly thinking about the care homes and the housebound populations. There is a separate site run by the ICS, which is the integrated care system, which goes right into Cumbria. It's the whole of the northeast, and that's at the Centre for Life. But that's not something that we're involved with, although obviously we do communicate with them, and that's something that's arranged really much more from central government than our local vaccination sites. And next slide, please. So to tell you a little bit about the different types of vaccine, there's the Oxford AstraZeneca vaccine and there's the Pfizer-BioNTech. The Pfizer one was the first one to come out, and that was the one that was in the news because it needed to be stored at these very, very low temperatures, needing very specific types of freezers to do that. Scientifically, they've used very different methods to create the 2 different vaccines, although they go on to create a fairly similar immune response. The main difference from our point of view is that they have very different operational and storage and transport requirements. And they both need 2 doses the same time frame apart. Next slide, please. I think somebody just put a comment in the chat there about there are some smaller sites as well, like Cragside, and some doses are also being given by the hospital, and those are particularly for health and social care staff. And for the other comments that come up, if it's okay in the chat, I might come back to those comments rather than going through them just now, just because it's hard to see all of them at the moment.
That's fine, Lorna.
Great. So there are possible side effects. The first thing to say is that lots of people have no side effects. Other common side effects are things like you might get one of or a combination of a headache, feeling tired, feeling achy, having a mild temperature, having a little bit of redness or soreness in the arm. Those side effects will usually settle within 24 to 48 hours, and usually things like paracetamol are quite effective for treating those. More serious side effects are very rare. With the Pfizer, one of the things that was noticed shortly after it first came through was around allergy. So initially there was some restrictions put in place around who could have the Pfizer, relating to whether people had had anaphylactic type reactions before. Those restrictions have largely come away now. There are just a very, very few number of people that can't have those, but I'm happy to answer more questions about that later if it's helpful. And the next slide. Okay, so we're conscious that having 2 sites across the city means that they're not going to be close to everybody. So we've tried to put some things in place to make that a little bit easier, just from a practical point of view. So everyone will be booked for these sites through their GP. Mainly, for health and social care staff, there has been a slightly different setting there, but I'm going to focus on the patients that we're booking through their GP. They can have access to a bus that can pick people up from the practice if there's enough people that need that to go, and Stagecoach are helping us with that. There's also various taxi companies that are doing discounted taxi provision. There is telephone interpreting available at the site, or what we're finding is that some people like to bring an interpreter with them. For most people, we would ask if people are able to come by themselves and don't need any support, then that's great for social distancing. But if people do need somebody to support them, either for interpreting or for some other need, then that's fine to bring one other person with you. All of the settings are on the ground floor level and are accessible in that way. In terms of information, there is lots of information out there, and I think one of the things we would like your support with is getting that information to people that need it in the right format. In terms of overcoming barriers for those people who have very significant barriers to accessing both vaccination and often other types of healthcare, that's something we're exploring quite actively with our colleagues in public health and local authority in the CCG. So that's a work in progress. And then in terms of vaccine hesitancy, we're aware that that can be an issue for lots of different people. There are lots and lots of resources out there to help us inform people and give people information to make a choice that's right for them, but is with scientific information in a way that people can understand. So the British Islamic Medical Association has put out lots of things around myths, which we can share that information with people if that's helpful. There's lots of stuff on social media. We would like to use community champions, and that's really where we sort of feel like we need your help and the help of the community, and that's really what we would like to work on with you. That's it.
Okay, thanks for that, Lorna. And now there's that's the basics of the vaccine, but I know we had quite a few questions that came in, which we had already sent to you. Do you have those questions in front of you, or do you need us to ask you them now?
If you've got them, I can get them, or if
I've got them, it's fine.
Great, yeah, if you could go through them for me, that would be great.
So one of the questions was, you've mentioned what the different types of vaccines are and timescales for timescales for all the rollout, but also the timing of the second dose, because obviously that has changed from the initial plan.
Sure. So the timing for the second dose would be the 11th week. That's the guidance is up to 12 weeks. We are aiming to give people appointments at 11 weeks.
And will people automatically be told about, how will they be told that it's their time to go in?
So it will be in the same way that they were invited for the first one, which I think for most people is through a telephone call from their practice.
Great. Okay.
Oh, Kate's got the main.
Yeah, can I just add that you will need to have the same vaccine as you had before, which is the Pfizer or the Oxford, and also that you'll be going back to the same site, or you'll be invited back by the same team. So if you had your vaccine at Centre for Life, for example, you can't then attend a GP-led site. And we do run 2 sites, but just to make you aware that it's quite important, because we need to keep an eye on who has and hasn't had their vaccine. So it's important for patient data and records. But like Lorna says, you'll either get a call from your GP or contacted in that way from our site. And this is really important to note, that there are vaccines. Somebody's already mentioned different places for vaccines. We are literally just talking about the GP-leds, and we've done the most of the vaccines in Newcastle anyway, so we cover up quite a lot of it.
Yeah, there is a little bit of confusion between the Centre for Life and the local vaccination site. So I suppose when we're talking about the local vaccination sites that we're running, which is the Eagles and the Racecourse and the home visits and the care homes. So we're happy to sort of acknowledge that there is that confusion, but just to say that we are, and we can answer some questions on that if people have got those questions, but we're talking about the local vaccination sites.
Okay. Thanks for that.
Can I just ask something?
Yeah.
It's more scientific. So I've heard that the Pfizer uses a different method of the vaccination as compared to the AstraZeneca one. So if the method of developing the vaccines are different, then how can we say that there's going to be more limitation of the virus attacking anyone else if everyone's having a different vaccine? So shouldn't the whole population get one single vaccine rather than allowing the variant to diversify even further? I know that's very scientific, but it's more like it's kind of for my own self, basically.
Yeah, so I think the question that you're asking is, if we're using different ways of producing vaccines, is that increasing the likelihood of there being more variants coming? Yeah. And the answer to that is no, because although the way of producing them is different, they all work through this spike protein method, and they all produce a similar response in the body's immune system. Now, that is different to the fact that the virus, whatever we do, the way that viruses work, there will be variants that come through in the same way that there are each year with flu. So there's nothing that the scientists can do to stop there being different variants.
I'm just reading a lot about vaccines right now, considering the whole pandemic situation. It's like, yes, I understand with the spike protein, but the spike protein affects in different places, like the ACE receptor protein. That's where it's affecting, basically. But if an RNA-dependent vaccine is being formed, and then an only spike protein-dependent vaccine is being formed, then it has a different mode of action in the host. And if that's different, then if the spike protein hypothetically changes in the coming days, then the vaccine that was supposed to be against the spike protein, that's no longer valid, is it?
So I think it might be helpful to go into these sort of very scientific details. I wonder whether it's more helpful to have that conversation in a separate setting, or we can carry on with that here, but I'm just not sure how helpful that is for others. But maybe if you could put your query in writing, because it sounds like you're very informed about it, and I think that would be really helpful to have your query maybe on email, and then if I can't answer all of it, we could take it to somebody else who could. But I think what we have to acknowledge as well is that no one company can produce enough vaccination to cover the whole population. So that's the other issue. But those sound like really interesting and useful questions for us to consider. So I wonder if you could email those to us and we could get back to you.
Jabira, if you email that to Carrie, and we will make sure it gets passed on, so we can do that. And I think that is a good way of dealing with that. Actually, linked to that, it's one of the questions is, do people have a choice of which one they get, and how is it decided that this is the vaccine you're having of the two that have been done?
So there isn't really much choice, or there isn't really any choice given to people, just because of the way that the vaccine supply is given to us from central supplies. The only reason that people would be given one vaccine over another is for clinical indications. So, for example, the particular allergies that I was talking about that might mean that you've not been able to have a Pfizer vaccination would mean that you would then go on to be invited for an AstraZeneca vaccination.
Okay. And just actually something from the chat I've seen, there's someone's asked, is there a risk for people who've had a nose job or eyelid surgery, or I suppose any surgery, that having a vaccine if you've recently had surgery? Is there an issue with that?
No, that's not one of the contraindications of recent surgery. In terms of if you were still unwell, if you had a fever or an infection or anything like that, then we would recommend not having a vaccination in that period, but just surgery per se, no. Okay,
that's great. These two questions are kind of linked. Someone's asked, what does the actual vaccine do? I suppose, how does it work? And another one's asked, is it a live vaccine? And I suppose they're quite related about how does the vaccine actually work?
Yeah. So no, it's not a live vaccine. And there are scientific sort of key differences about which receptor works on what and all that sort of thing. But the broad principles are that the vaccine recreates a response that your body would have if it were infected with COVID, and produces different types of immune response within the body that then, when it meets the real virus, it's already primed with that immune response, so it can produce the certain types of cells and chemicals within the body that produce that immune response. I don't know how technical or scientific people want me to be. I don't know if it's helpful to talk about that in more detail, or if people feel it's hard to know what everyone's background level is, and just let me know if you would like more information than that or not.
For the person who asked them, what does the vaccine do? How does it help me? Would you like to know a little bit more detail? Just say yes or no, or put in the chat. No.
Again, if it's difficult in these large settings, if people have other questions after this that haven't been fully answered, or they need more information, again, if people just email it and we can get back to them.
Okay, that's great. I'll move on through the other questions that had come in already. You've talked about the side effects in your presentation. As someone's asked, what is the risk of going out to get the vaccine? Because obviously, I think people are quite worried about that. They've been told to stay at home and not leave home, and then they're being asked to go to a centre where there's going to be lots of people. So how's that being managed and keeping people safe?
Yeah, so that's something that we take really seriously for those reasons. And the advice is that we should have sites where the flow is good, so that people aren't queuing for hours and hours next to each other. We should have sites that are big enough and got good enough ventilation, and we're lucky in Newcastle that our sites do meet those requirements. We do ask everybody that comes in to wear masks, whether that's patients or staff. Obviously, there will be a few people for whom there are exemptions, but we would ask people as much as possible to comply with that requirement. There's lots of cleaning that goes on after each person's been through, the area is cleaned. So there are all those things put in place.
And I know people who have been to the site and they said it's an impressive operation, what's been set up, and it's done in a really safe way. So I have had that reported back about Newcastle centres of how good it's been done. Yeah. Just some other questions that have been asked is the vaccine suitable for all ethnic races? And if yes, is it tested on everyone? Because obviously different ethnicities have different immune systems. So it's about, I suppose, how safe is it for everybody?
Yeah. It is safe for everybody. In terms of who the research was done on, I'm afraid I don't know, but I could find that information out for people if people would like that again to follow up. And remember that this is a virus that affects everybody, and it affects certain ethnicities. The data shows more so than others. So, people are at risk. So the vaccination is used. Remember, it's going to be used. All different vaccinations are going to be used across the world. This is a global problem, and vaccination is hopefully going to be used in all parts of the world.
Okay. Another question was, how
Kate
long?
wants to come in there.
Yeah, I was just going to add, and Lorna, correct me if I'm wrong, but we have seen very, very, very few cases of issues with the vaccine being delivered, and we've delivered in northeastern Yorkshire more than 500,000 vaccines, I think, and millions across the UK, with only a few examples of anaphylaxis, which everything else has been noted. And I think it's important to note that the mass factor of this is that it's being tested and monitored all the time, and there had not been, I mean, Lorna's talked about the side effects, there have not been serious side effects except in some very, very few cases. So in terms of the testing, it's not just the testing, it's the ongoing rollout as well, that we've got data coming in all the time, and we can be assured, because almost every group that we know of has been given the vaccine. Lorna, I think it's probably, without going into the data, but if you want some more information about that, that is definitely something we can look into, and we completely understand where people have concerns, and we want to make sure that if we can't answer them here, we'll definitely take them away. But I think it's important to know that a lot of people have had the vaccine with little or no effect. So
that's good. Yeah. Someone's got a hand up in the chat. Not the chat, in the forum. Tebabu, I think I pronounced that right.
Hi. Yes. I just wanted to add something. I'm also a doctor, by the way. I'm a gynecologist, and although I'm retired, it's a question asked about the Black and ethnic minority group. As far as I know, the data shows that 3% of the trials were in the States were done on Black and ethnic minority group, although 97% is white. This is not a selection. It is because people voluntarily went to try the vaccine. But on those 3%, there is no different side effects. It's exactly the same. So I agree with the doctor. I think what she said is true. As far as we know, there isn't any particular side effect with the Black and ethnic minority group.
Thank you. That's really helpful.
I know generally in research there are issues around getting enough of all the population into research, but there will have been research done on all groups on this, even if it is a smaller number. It is something that's an issue for all research, I think, that we're trying to address as well. Again, moving on to other questions is, how do asylum seekers get notified if they're not registered at a GP? Because if this is going through everyone's GP, and I know we've got some people in hostels, for instance, in Newcastle, asylum seekers who may not have a GP registered, what happens to them?
Yeah, so that is a barrier, and it's something that we are really aware of, trying to work with other organisations to overcome that. So we are hoping to go out to some of the hostel sets. So we recognise that to capture some of these people in this approach, we might need to use some different approaches. NHS England have told us that we do not have to have people registered with the GP in order to vaccinate them, which is different to lots of other healthcare services that we provide. And we are working with, again, public health, local authorities, some of the homelessness charities. I think we would like to work closely with Western Refugee Service and other, BCS organisations to try and make sure that we are offering it to all those people, because everybody's entitled to it. And so I don't have an answer as to how that's going to happen, but we are working very hard to make sure that we can offer it to those people.
I suppose then at the moment, if they're asylum seeker and they're not registered at a GP, what should they do at this point? Is there somewhere they should go and actually say that I'm not registered with the GP, so that they're coming up on the radar?
Well, the best thing to do, I suppose, for lots of different reasons, would be to register with the GP and you should be able to do that without any ID and all of those sorts of barriers. If that's too difficult for people for whatever reason, or there are barriers to doing that, then I suppose maybe going to speak to one of the organisations like Western Refugee Service would probably be a good first step. We may not be able to offer the vaccination there and then, but at least then they would be included in whatever solution we're trying to come up with. Does that make sense? Sorry, Vicky.
You've got your hand up again.
Yes, yes. Thank you. I actually raised this question a few weeks ago with the Regional Refugee Forum and Connected Voices. The answer I got was that the Home Office is actually looking into the matter regarding asylum seekers who have not yet registered with general practitioners. Whether the Home Office has come to a decision or not, I don't know, but that's what I've been told.
Great, thank you. It would be useful to know if there's anybody here, who here is in organisations that serves these populations. I think centrally they are aware of these kind of problems, but in general, central government is quite slow to move on this. But what they have said is that we can come up with local solutions, and I think we will move quicker coming up with local solutions than waiting for a central solution. So that's the plan in Newcastle. But if there's anybody here that would like to be involved in those discussions that isn't already, that links into those sectors, that would be really helpful.
Okay, thanks for that. Another question we had was about interpreter provision. I know you said I think you've already answered that there can be phone interpreters on site if you need them.
Yeah, and again, it comes down to individual preference. We do have a language line if we need it, or sometimes people have come through and they've had family members on the phone or brought people with them. There is, we can accommodate those various different provisions.
Okay, that's great. Will people who've had the Pfizer jab still get good protection after waiting the time for the second dose? Has it been extended? I know there's a lot of worries about what that actually means for both jabs, really, isn't it?
Yeah, and yeah, it's important to acknowledge, I completely understand why this has caused a lot of concern and confusion, because the guidance did change. The positive news about that is that increasingly the evidence is showing that after about the 3-week mark of the first dose, that the immunity is good, and that actually the second dose tends to give you that more prolonged immunity, and that there's a fair bit of evidence coming now that suggests that actually waiting a little bit longer, so up to the 11 or 12 week mark, actually may improve that immunity going forward.
Okay, thanks for that.
I think there was a question further up on the chat about medication, if you're taking other medication.
I'll let you answer.
Yeah, so the answer about if you're taking other medication, that's not a reason not to have the vaccination. You should definitely still have the vaccination, particularly because if you're taking other medication, it suggests that you've got other medical conditions, and having other medical conditions is associated with, can be associated with more severe outcomes when people get COVID. So that will suggest that you are at greater risk and will be invited sooner than somebody else who's not on medications.
Okay, there's a good question in the chat there, is how long is it going to offer immunity for? How long will the first round of injections last?
How long will the first dose?
Yeah, so if you've had 2 injections, how long will this keep you immune for?
We don't know. The research is ongoing. I think that the things that I've read and heard suggest a minimum of 6 months, hopefully a bit longer, but I think that there's more data needed. We just don't know that for definite yet. Kate?
Yeah, and just to add to that, please note that once you've had your first and or your second jab, there is still important that you follow the guidelines. So actually, please still follow social distancing and wear a mask. That actually we don't know for sure whether or not you can still spread the virus even though you've had the vaccine. So it's really important to still make sure that you stay safe and keep others safe as well while we're waiting for the rest of the evidence. Is that fair enough, Lorna?
That's fair, and I think it's fair to say that we think that people can still get COVID after. Some people can still get COVID after they've been vaccinated, but it tends to be much less severe. So it tends to reduce the need for going to hospital or, for needing higher levels of care in hospital. But certainly, we think that people can still pass it on, and there will always be some people in the community that haven't been vaccinated. So yes, the need to still follow all the social distancing measures will be in place, and that will all be decided by the Chief Medical Officer and implemented locally.
I'm on mute, I keep doing that. It's about 3 weeks, isn't it, from the first vaccination for it to really properly have an effect on your immunity?
Yeah.
So you need to be very careful during those 3 weeks. A really good question, this is about, can pregnant or breastfeeding women get the vaccine?
Yeah, they can. So breastfeeding women definitely can. Again, there was a little bit of confusion initially. It was said that people could have, but they definitely can. The situation for women is that if they feel that in discussion with their midwife or the healthcare professional, or in their own opinion, that they are at high risk, then they can get the vaccination. So we are finding that lots of healthcare workers, frontline healthcare workers who are pregnant, are choosing to have the vaccination because they feel they are at greater risk. So the guidance is that that is for discussion between the woman and her healthcare providers.
Am I right in saying that they don't generally do research on pregnant women?
Yeah.
So that was one of the reasons why they weren't sure if they should go ahead with the injection, because research hasn't been done about the impact of it. Is that correct?
Yeah, that's it. So there's this issue between, there isn't evidence of safety, but that doesn't mean there's a lack of evidence, but not evidence of lack. So we know that similar immunizations, vaccinations are used in pregnant women very, very safely. And pregnant women have now been vaccinated. And remember, the vaccination has been going on in other countries before it came to the UK. And we are using that data too, and there's no evidence of any problems.
Okay. And children, what's happening with children vaccinations? Is there an age, what's the age that vaccinations are starting from, and if why?
Yeah, so Kate, I think we are inviting people from the age of 18, so it's adults only. It is actually licensed in certain conditions for those who are 16 and over. Those would tend to be those young people who have got very severe complex disabilities or other medical conditions, usually under the care of a specialist, that would increase their risk if they were to catch COVID. Children younger than that are not being vaccinated, and there's no plans to vaccinate them, in part because this is, in the huge majority of cases, a disease that does not adversely affect children. And my understanding is that there's been no research done on vaccinations for children, although I don't know, but it's certainly not licensed for children under the age of 16.
Okay, so at the moment, children will not be getting a vaccine at all. No. There's a question actually in the chat, which is linked to about breastfeeding, is if you're breastfeeding and get vaccine, can you pass the efficacy of the vaccine to the child via breast milk? Very good question.
I don't know. It's a very good question. And we know that other immunity is passed through breast milk. I don't know. Can find out.
Yeah, it's still not unsure, I suppose, isn't it? Because as you say, it's a new situation. So yes, we'll see.
Very good question.
Yeah. Question about carers. Can carers who are caring for their elderly parents or parents in residential care who limit visitors to those who've been vaccinated get priority or get the vaccine sooner?
So they are within the JCVI cohorts, but they're not. I would have to have a quick look to remind myself whereabouts. At the minute, they're not in the priority group that we're vaccinating at the moment, these informal carers. That may change, and again, it may change locally, because we recognise the huge role that these people play. And if somebody who is a carer falls ill themselves, then that obviously has a big impact on the person that they're caring for, as well as the wider community and system. So the answer is not at the moment, but again, it's something that we are very aware of and looking at.
And actually, that's something you've said there, Lorna, is it might change locally. So there is the national guidance on how vaccines are happening, but locally there may be some slight differences to that. Is that right?
We still have to work within the JCVI principles and those cohorts, and anything that is agreed locally has to be agreed completely across the system and has to be in line with the principles that the JCVI put forward.
Okay.
But yes, there is some local flexibility.
Okay. Again, if someone in care, this is a good question, who's not willingly accepted the vaccine and may have challenging behaviour on the day of having the vaccine in the care home, does they have authority to put a restraining order to get the vaccine? Are they being forced to have the vaccine in care homes if they're saying they don't want them?
Sure. So I suppose we're talking about if somebody doesn't have capacity, which we would assess under the Mental Capacity Act legislation, we would then make what's called a best interest decision, unless there was other frameworks in place like a power of attorney or something like that. Individual best interest decisions are quite complex and would be very much case by case. So in the vast majority of cases, if somebody was going to really fight against a vaccination and put themselves at risk of a needle stick injury or put the staff at risk of a needle stick injury, there are other options, but that would be a very complex case that would need a lot of consideration. But in general, you know, the principle around capacity and best interest decisions is one that we would use in those cases.
Okay, thanks for that. Right, that's all the questions. Go on, Kate.
I was going to say, Lorna, do you want me to read out the line on carers from the
JCVI
cohort? So the JCVI is the Joint Council for Vaccinations and Immunisation. So it's the national body that makes a decision. According to this, we have 9 groups. So the first group is residents in a care home, older adults, care home adults and carers, and it goes down over 80, over 75. Number 6 is individuals aged to 64 years with underlying health conditions, and there's a note that's added to that which says this could include those, and this is the important line. Other groups at higher risk, including those who are in receipt of a carer's allowance or those who are the main carer of an elderly or disabled person whose welfare may be at risk if the carer falls ill, should also be offered vaccination alongside these groups. So that's the line on carers. And so
and I think that's been brought in a little bit more recently, I think, following some feedback that they've had. So we are coming towards the end of cohort 4 in Newcastle, and then we will go into 5 and 6. So thank you, Kate. That's the answer. Those informal carers are in cohort 6.
Thank you. Someone's just asked if you can just remind us again of the side effects of the vaccine, and are there different side effects to the different vaccines? Because they are 2 different vaccines.
They have pretty similar side effects. So tends to be things like local irritation at the site, sore arm, headache, fatigue, muscle aches, a mild temperature. You wouldn't tend to get all of those. You would tend to get maybe either none or 1 or 2 of those.
Yes, some people have none at all, don't they? It's just, and some people are experiencing some side effects. I know from the people I've spoken to about that.
And I get the key is they should usually settle within 24 to 48 hours. If anything's going on longer than that, it's not a side effect. Most likely it's not a side effect and it's a symptom in itself. So.
And then, because
can I go back to the person who had asked the question about somebody who might not want the vaccine who's in care, had also added to that question, would it be possible to get a vaccine offered in the home environment if that would somehow ease the process of getting that vaccine for an individual who might not want it?
So for a person who lacked capacity to make the decision for themselves?
Yeah. So I think the question was, would a vaccine ever be offered in a different, maybe more comfortable environment that might help that person get the vaccine?
Yeah, so that is something that we have gone out to do that for people who are classed as housebound, and that might mean different things in different cases. So yes, I think the message would be, if anybody is really struggling to get to a vaccination centre, to let their GP know, you know, we are working very hard, as I say, to sort of overcome the various barriers that might be in place for different people. And we would try and sort of find out what the issues were for that person and see how we could work around it.
In terms of contacting GP though, don't contact your GP to ask them when you're having your vaccine.
No.
Is that correct? You need to wait until you've had a letter. Is that correct?
Usually a phone call, because so for most people it'll be a phone call, or some practices going forward in the future we may be able to get a more digital solution for those people for whom that would be convenient. But at the minute, for the vast majority of the people that we're inviting, it will be one of your practice receptionists phoning.
And is there anything that people should do to check that is the valid phone call? Because I know I've seen things that we've been sending around vaccine scams, and it's just to make sure, make sure that people feel safe about who they're speaking to.
Yeah, that's a good point.
If it was your GP, your reception would ring up and say, normally what would they say?
Well, I think they would normally say what their name was, where they were calling from, and if you wanted to, you could phone back.
Yeah,
that would be completely reasonable.
And normally, sorry, Kate, you go.
I think the important point to note is we will never ask for any money, and we won't be asking for personal details because it will all be on the system. So we will have your NHS number and your name and address. And so you will just be asked, would you book a shift? Would you book a vaccination session at Racecourse at 9 o'clock on Friday, whatever? You turn up and then you get your vaccination, but you won't be actually asked for any data, Lorna. That's correct, isn't it? Because we've got it all in our hands, but you'll never have to pay. I think you've got to be more wary of the digital scams, because that seems to be the thing that's quite rampant at the moment. But yeah, you're fine with the GPs. They won't ask you for any information, and if anybody does ask you for personal data, then it's not your GP.
And so don't then give them any of that information.
Sometimes we might just say, can we confirm your date of birth?
Yeah, fair enough, Lorna. Yeah,
we're talking to the right person, but we would certainly we won't be asking you for money, and all we will be offering you is an appointment. So
that's really important. This is free. The vaccines are free. You should not be paid for it. You're being paid for it, and somebody shouldn't be coming to your door and offering to do it at your house.
No,
that's not.
So that's fraudulent if that's happening.
Okay. Someone's asked, can carers contact anywhere to see where on the list they are to get the vaccine?
Well, in terms of the information is freely available about the cohorts from as Kate mentioned, the Joint Committee of Vaccinations and Immunisations. In terms of how far through we are in each cohort and where you are on the list, unfortunately, no, we can't offer that, just because that would be a full-time job in itself. So.
There's also someone's raised that a carer is unable to visit their mum in residential care until she's been vaccinated, and obviously, is there anything they can do? But unfortunately, I think you're going to say that it's just a case you have to wait.
It is, unfortunately, and I think different care homes will have different advice about what that vaccination then means, because as Kate was mentioning previously, we are being advised from public health that all of the advice around COVID security and safety will remain the same until it starts to lift centrally. But different care homes in that situation will have different advice. But yes, in terms of finding out where you are, that wouldn't be possible.
Okay, but they are getting through the vaccine rollout really, really well and really effectively.
Well. Yeah, in Newcastle, it's going really well.
Another question is, there are some assumptions in some communities that this vaccination will affect the fertility in males and females. Is there any truth to that?
No, there's no truth to it. We're aware that is one of these myths that is doing the rounds, and there is no impact on fertility, none at all.
I'm just going to share a link to a video on that just to back up what Lorna's saying, so you can, for that question on fertility, have a look in the chat.
Thanks, Kate. So one of the workers from Newcastle Carers, obviously they're getting asked loads of questions about this from the people they're working with, the carers. So what's the best advice they can give to carers, or where can they signpost them to get the best information about this to help them deliver the right information to the people they're working with about carers? About
when carers will get the vaccination.
Yeah.
Well, I think we can say that in Newcastle, we've nearly done all of cohort 4. Carers will be in cohort 6, So it will be soon-ish. I mean, I don't know what, it sounds like there's probably some more specific information that person asking the question is thinking about. So I'm aware that that's probably not a very helpful answer if there's anything more specific that would be helpful. But I think in terms of when an individual will get their vaccination, we can't be very specific on that.
Okay, actually, this is a really good point from Tracy Hewitson, GP, who is a GP, and she's saying no matter what, you should be telling your GP practice that you are a carer, so they can put that on your records in case they haven't got that, because it's important. There might be extra support you can get, and it's then flagged on your records in the NHS, in the GPs, that you are a carer, and there's obviously a need for extra support there.
Yeah, and that's a really good point. And that means then that when we get to that cohort, we will have that information and it will flag automatically for us to invite you.
So that's probably the key thing for the carer centre, saying make sure the GP knows that you are a carer and you have care responsibilities. In terms of so I've got no more specific questions, but you're all still here. Is there anything that anyone wants to ask? Because we've gone through the questions we had. It's been a bit like mastermind, isn't it? Like, let's just check how much you actually know about vaccines with it like an exam almost. Is there anything anyone wants to ask? If so, you can put your hand up or just come off mute and ask the question. I'm not seeing anyone.
We've got lots of good resources that we're really keen to get shared into the community that answer a lot of these questions in a bit more detail, some of them with good visuals and explanations, videos, posters, all of those sorts of things. So maybe again, if we share those with Carrie, she could share them out.
We'll definitely do that. I've got a question, there's a hand in the air from Huda. So if you would like to ask.
Oh, yes, hello. I'm also wondering, people who had COVID previously, do they need to have vaccination?
At present, the guidance is yes.
Okay, thank you.
So even if you've had COVID, you should still have the vaccination.
Great, thank you.
Okay, I didn't know that. That's something I've learned. And is that because why is that? Well,
it's because we think the evidences seem to suggest that once you've had COVID, you probably do have some immunity, but different people will mount different immune responses, will have different amounts of immunity afterwards. It depends on the dose of virus that you've had. There's lots of variables. And so the safest thing to do is just to vaccinate everybody.
Excellent. Is there anyone else who would like to ask a question? Tebabu, would you like to ask again?
It's not a question, it's just on what Dr. Longworth said. It is true. People who had COVID infection, the most recent evidence shows that the immunity only lasts for about the longest is 6 months. So definitely after 6 months, you are not covered, so you need the vaccination.
And then we wait to see how long the immunity of the vaccine, but that's going to be a future issue, isn't it? The main thing is actually getting vaccinations all done as much as possible, and then we'll see when the next batch then have to happen.
That's right, yeah.
Thank you for that. A question came from the community about what is the vaccination made of? Now, this is a really good point about animal products being in it, whether it's halal. So what's actually the vaccination made of?
So the list of ingredients, again, that's on the website and I can share it. It's a lot of chemical names that I don't have off the top of my head, but the important is that there are no animal products, there's no pork products, no egg products, no animal products at all in it.
Good, that's excellent. Any other questions or any other comments people want to make while we've got, yes, I think Sandra, is it in first step?
Oh, am I on mute still?
No, we can hear you.
Oh, hi, hello, this is Hayley. I'm sorry, my computer wasn't working today. I was stuck in the waiting room, so I'm on my phone now and I'm not so good. My mum had her vaccine done and it said something about chimpanzees on there that she was quite confused about. I said, I think it's made from a virus that comes from monkeys or chimpanzees, a cold virus. But the mention of it on the leaflet that she had kind of confused her. I don't know what it actually said, so maybe one of you knows instead.
Yeah, I don't know. There are lots of leaflets out there, and again, I don't know which leaflets and what exactly the wording would have been, but you're right, the way that the vaccine is made is by deactivating a virus that infects other primates, which is you know, using these viruses that infect other animal groups is a really, really common way of developing lots of different vaccines. It does not mean that there's any animal product in the vaccine. So that's the message. There is, I think that is why some of those myths have come about, just because of the word. But it's just a way that vaccines are produced. So there's nothing to do with the chimpanzee in this vaccination, nothing to do with any other types of animal products, but I can completely see why that does cause some confusion. But it's just reassurance out there. It's just the way that the vaccination is made. It doesn't have any of those animal products in it.
Okay, thanks for that as well. And I had actually, so when we put this out to say that we were doing this session, I got regional response of people saying they wanted to come to it, which we wanted to keep it quite small at this point. But what do I go back to those who are living in other parts, not Newcastle, because the reason we've got you here is because you deliver this in Newcastle. Is there people like yourselves in other areas that people can go to get this vaccine information sessions? Do you know if we can help support that in other parts of the region, like North Tyneside?
Yes, so every region has its own clinical directors in the same sort of arrangement that we have in Newcastle. So I would suggest, is this coming from individuals or from organisations?
An organisation.
I'm happy to help with that, Lorna.
Do you have some of the contacts?
Yep, great. I'll take it off your hands. Vicky, if you just let me know, I can find the relevant contacts in those areas for you. That's absolutely fine. Lorna's got enough on her plate.
I shall do that, thanks. And just a comment in the chat, I think the vaccine is allowed Islamically, even if non-halal products are in it, as it's to save a life. I don't know if this information on any literature or verbally passed on onto the Muslim communities. I believe, though, it's halal, isn't it? Because there are no animal products in it.
That's correct,
yeah. So thank you for that, Jabira, for commenting on that as well. Any other points that anyone wants to raise? Or if you have any questions you think of afterwards that you feel that you need an answer to, if you email them to Carrie, who set the group up, set this meeting up, you'll have an email from her, and we will then share them with Lorna and Kate and get answers and then send them back out to you. Is that okay? Is everyone happy with what they've heard? Do you feel like you've had you've learned a little bit more about vaccines and feel a bit more reassured about how to support people and what to tell people? Obviously, I can't see anyone to see what they're saying.
Can I just add that we would really like your help? I think Lorna mentioned this at the beginning, because for us, you are your communities, and for us to be able to rely on you would be really, really helpful. So if there's anything that we can do, any materials we can provide you with, like Lorna has said, anything you can translate for us or take out, we're actually doing a huge amount of outreach work, but we'll need your support. So this is a plea, really, a call to arms for you to maybe contribute if you can. So Vicky and Carrie, if you can coordinate that, we'd really appreciate it.
And I think also if you in your communities are hearing about struggles that people are having to get the vaccine, practical things or just things that are making it difficult, barriers that people are struggling to overcome, let us know. And we can't promise to fix all of them straight away, but I think the more information we've got about why it might be difficult for some people to access the vaccine, the more we can try to overcome that.
I think that's really, really important, so they can contact us through Harith, through Carrie or myself or Wajid, if they're hearing of specific barriers or specific issues that are making it difficult, or hearing some myths that need challenging, and we can help facilitate getting the right information and sending it out. Harith has we have our bulletin that goes out once a month, and I also have our email contacts, which we send out information once a week at the moment, myth busting and providing factual information, and we will continue to do that. So if we develop anything, we will get it out to as many people as possible through our email contacts. And
Wajid's mentioning that the British IMA website is really, really good, and they put out lots of stuff on social media as well, so that's a really good resource.
is actually very good, not just, it's actually really clear for anybody. It's actually the myth busting that I've put on is actually really useful for anyone to look at. And we have shared that already through the Haworth Bulletin and through our networks, and we will continue to do that.
Lovely.
Okay, I'm not saying any more, and so I think what we're going to do is we're going to round it up now. Thank you so much, Lorna, Emily and Kate, because you are so busy people. Thank you for your time and for putting yourselves on the spot
Thank
and
you.
answering our questions. So I really appreciate that. You're now free to go back to your day job.
Thanks everyone for the questions and the time. Bye-bye.
Thank you.